episode. We got the man, the myth, the legend, Marcelle Gathing with us. I thought it was Gathing, but it's Gathing. So we got an episode with Zing Health ready to go. So we want to just, maybe you could give us a little bit of a background on your experience in the industry, how you got into this exciting insurance game, and ended up at Zing.
Yeah, well, just like everybody else, my Halloween costume as a kid was to be an insurance agent, right?
Yeah,
so,
right.
Exciting.
Yeah, exactly. So I've been in the industry coming up on 20 years. I actually started selling over the phone as a telesales agent on the under 65 side. So I was doing, reading the underwriting manual and getting...
You evil person, scamming people
getting
out of
yelled
money.
at by bodybuilders, right, who, were 4% body fat, but they were over the BMI chart, and so getting screamed at by them, getting my licks in. But I started as an agent and then moved on to like a broker executive role, where essentially you've got a hierarchy of field agents that you're calling into and, doing training, talking about product expansion, helping with strategy. Did that for a year or so, and then moved into kind of the national accounts world that I've been ever since. And I started doing that for under 65, working with a lot of the traditional field shops that have offices around the country. So same thing, doing training, working as the main point of contact. And a lot of this time was at Humana. And I was in like 2012, came in under the Medicare side of the house, and then had responsibility for both main product lines. So started on the field side for Medicare, helping agents with presentations, strategy, product updates, all the traditional kind of account executive sales management role, and then moved on to the telesales side, probably coming up on almost 10 years ago now, and have been doing that ever since. So in my current role, I'm the Director of National Strategic Accounts at Zing, so I manage our external call center distribution partnerships and our internal direct-to-consumer call center relationships as well, and then help out with a lot of just kind of overall strategy work up through our growth organization. And I've been here for 2 years in January. So I was recruited over, and the selling point for me, which I'm sure we'll get into, is really the history of Zing and what we're trying to do differently in the space. And I think we've got a lot of things going on that differentiate us in the market that I was really excited about, and convinced me to come on over after 17, 18 years at one spot and try something new.
Yeah, you're still out of Madison, right?
Yep. So I'm based in Madison, Wisconsin.
You still are bumping into your ex-Humana colleagues there, I'm sure.
All the time. Yeah, we all live pretty close. I can throw rocks at most of their houses, but yeah, we're
it's
all
kind of a mecca
friends.
For.
Yep.
The Tampa Mafia is not a thing anymore there. So.
No, yeah, I know you're an insider because you know the Tampa Mafia phrase. Yes,
oh, yeah.
No, they're all have now vacated back to Tampa.
It's the Madison,
Yeah, now it's the Madison Mafia. That's right.
The cheese mafia.
Exactly. No, it's cool, man.
Yeah, well, one of the reasons why, because a lot of people that listen may not have heard of Zing before. Yep. Smaller carrier, and for us, we've talked before. We're pretty selective about the carriers we want to work with, and you guys being a smaller, kind of one of the next generation of MA carriers, we really kind of found out about you guys because of the old dead LASSO plan, and the LASSO was that MSA that was fairly popular out here in the western, more rural states for the past few years, and then that was kind of how we found our way to our initial partnership, was through that dead and gone product. But one of the things that we really liked about Zing and what we like about you guys right now is, number one, we're looking for carrier partners that actually want to grow in this market, which seems like a weird thing to say, that we're actually looking for insurance carriers that want to grow their business, but it's not so easy in 2024 going into 2025. So
if you're not positioned very well financially, then that's a tough proposition.
Yeah.
So, I mean, the other thing, I think it's a good moment I wanted to pop into, just to kind of talk about the kind of the litmus test that we go through on our side, and why we decide to bring on certain partners and carriers and why we don't on others. Because again, I've been asked this probably 5 or 10 times over the last month or two, and people say, well, how come you guys brought on this carrier partner, but not that one? And so for us, just for people listening, is we always want to look first and foremost at the product that the consumer's going to have, and is it a good product for the consumer? Number two, is it a good experience for the agent, right? And what does that experience really look like? Number three, how easy is it for us as an FMO to do business with that entity and have that relationship, right? And then also, can the agent make money and get paid, and can we get paid? So, I mean, those are really the things that we go through, and there's a whole series. But
I would add one more, and it's leadership, right? Like, and shout out to, you and guys like Chris Murray and those guys that we've had.
And Andrew Clifton.
Yeah, Andrew Clifton was how, Dan knew of your team. And so it's the leadership behind the program that we really had other business dealings with in the industry. And like we say all the time, this industry is very, very small, very incestuous, Game of Thrones. And, you never know what relationships at which carriers or former organizations are going to carry through. And so that was, some of the why. But then not only that is we do believe that Zing is a carrier that is identified a market opportunity. And we think that the specialized products are going to be the future, and that's kind of been driven home by the CMS call letter recently. And we haven't even really got into that much of the different types of products and the specialized plans that are coming out. But maybe you could talk about, what makes Zing different, what drew you to Zing, and kind of like what the identity as a company is like.
Yeah. Well, I mean, first of all, like you said, it's, we're an up and coming plan. A lot of people are learning about us right now. We have a regional footprint, right? So depending on where your agents and partners are listening from, they may or may not have a Zing product in their market today, but we hope to change that over time. What drew me was Zing was founded by two African-American doctors on the south side of Chicago that just noticed, hey, no one's really building plans for seniors with chronic special needs, right? All that's happening today is they're kind of getting shoved into the general enrollment MA plan or maybe a D-SNP plan, and the carrier is just hoping to be able to manage the care on the back end to get their higher reimbursement and have the business be profitable, right? But that doesn't create any value for the actual member. Mm-hmm. So our doctors said, we're going to do it the other way around. We're going to build products on the front end that are provide real value to seniors, and then we're going to have a best-in-class experience on the back end to manage those members. And once they engage with the plan, they're going to stay because they're going to see the value they get in the plans. So what drew me to Zing was kind of the story, the markets that we're serving, and then looking where the industry is going, as you guys have said, and you guys look at all the numbers just like I do. If you look at the participation rates by product type over the last few years, C-SNP was like 2%, 3%, then it jumped to 11%, it jumped to 42% last year, whereas now D-SNP is starting to stagnate, right? And so the theory we always put out there, and it's coming to fruition, is C-SNP's kind of the next frontier.
Yeah,
7-8 years ago, carriers were afraid of D-SNP, right? They didn't know if they managed the care, they didn't know how to build the products. Brokers were knocking down their doors saying you guys are missing a huge opportunity. C-SNP is that next wave. 50% of MA eligibles have a C-SNP qualifying condition. Less than 2% of them are in a plan. And so it creates a tremendous opportunity. There's way less competition. You guys know this. The markets are so saturated. You have 65 plans in a given metro market. You look at C-SNPs, you're going to have maybe 2 or 3 products. And we know that ours is going to be the best product. When you look at Milliman MACVAT total value add, the way that we build the plans is designed to give the most upfront and kind of condition-specific help for our beneficiaries. So they're getting something tangible, and then we follow through on the back end. We've got above average NPS scores, 65 versus the industry average of 29. So we are getting these members in, and then we're doing everything we can to coordinate a journey with our VBC partners and then have constant contact with the members ourselves to make sure they understand how to utilize the plans, what the benefits are. And to your earlier point, because we are a newer plan, we want to make sure they understand what benefit we have so that somebody's not coming behind us, right, and just selling on a brand name, right, that maybe is in our opinion, not offering the same level of C-SNP specific benefit.
Yeah, and two things I want to back up on that too is, number one, I think that it's very current right now, especially because the social determinants of health have been a buzzword and topic for a number of years now with CMS and with trying to solve some of those social determinants of health, which, going back to kind of the founding and the starting of Zing and what it's trying to solve, I think matters. And then also, I've been critical of the SSBCIs over the last couple of years, right? And I think if we could talk about that maybe for a quick minute, because again, I think there was a big opportunity where there was that recognition of all the people who have these chronic conditions, and they were trying to get more obviously dollars and benefits to those specific individuals. But I think it was a miss in how the SSBCIs were administered and by a lot of the plans that maybe benefits in certain products were marketed or sold. Now, not with Zing, for those listening, with other carriers, where maybe, potentially some members could qualify for extra benefits, but it was very convoluted, the process on how to qualify for it. And then it kind of got some brokers sideways on, them misrepresenting products. And I think that was a bad experience. And so I think that going back to the core fundamental product of a C-SNP and be able to go wider and actually sell more of it is the right move.
Yeah, 100%.
I wanted to chime in on a couple of things. Obviously, for new listeners, C-SNPs are chronic plans, right? Chronic special needs plans. And he said something about, the NPS scores, which Net Promoter Score.
Yep.
That's essentially a consumer rating, and anything over like 60 is generally considered really good. That's like your Apples,
Benchmark,
your Starbucks, things like that. So obviously really good consumer rating scores on that as well. What are some of the, just for maybe new listeners or people who haven't sold a lot of chronics, what are some typical chronic conditions that can qualify them for a plan?
Yeah, and absolutely. And we should back up to right now, and we'll talk about footprint for both current and 2025. But right now we're in Illinois, Indiana, and Michigan. So Chicagoland area, Indianapolis, and Detroit primarily. And we'll be expanding about a 50% increase in total addressable market for 2025. So we'll have some new markets, a lot of additional eligibles that we can potentially serve, which we're really excited about. But in terms of the conditions,
drop the new markets real quick.
Yeah, so the new markets are Cleveland, Akron, which will be a really good market for us. Then Memphis on both the Mississippi and the Tennessee side, along with Nashville, and then a lot of contiguous growth into our existing markets as well.
Cool.
So we're going from probably about 4.2, 4.3 million eligibles in comparison to, I think, 2.6 or 2.5 right now in terms of potential marketplace.
So if you're a broker and you operate in those areas, hit us up to get a Zing contract.
Exactly.
That's our plug. And like, subscribe. One thing, just to interject right here so Matt doesn't get mad at us after, we have only 2% of our viewers that are actually subscribed. So please subscribe to the, if you're a lurker out there.
Lurkers, yes.
Please subscribe to the podcast. There's no harm, just good information. So like, subscribe, share, comment, and then if you need a Zing contract in those areas, hit us up.
We'll put a link in the video.
We'll have a link below in the comments here on YouTube.
Yeah. No, absolutely. So to answer your question, I mean, sometimes you'll hear people refer to it as the traditional bundle of conditions. Generally, that's going to include diabetes, congestive heart failure, and then CVD is usually what you'll see, which is cardiovascular disorder. And there's a list of several conditions that qualify within that subset. So I think the real opportunity for agents is to get comfortable understanding what sort of questions to ask. I think, quite frankly, sometimes agents are afraid to get closer to the health questions, but if you can explain why you're asking and that the member might be eligible for a plan that's more specifically tailored to them, they're going to understand the upside. But
the model of care, the MOC.
Well, and I think brokers, if you're listening, you need to get behind this more, and not just for Zing products, but if you look at the call letter this year, and we're starting to look into these more specialized plans and more, you're going to see more IE SNPs, and you're going to see more. PACE is even making a little bit of a resurgence. I don't know how, but it is.
There's a lot of Back to the Future this year.
Yeah, there's other products coming to the market that are going to require you to be more sophisticated and ask the right find out questions to place them on the product, not just for Zing.
And 100%. And the other one that we have today that will be expanding significantly in 2025, which I think is a huge opportunity, is ESRD. So right now, end-stage renal disease, ESRD, that the prospective member does need to be seeking dialysis. It's not stage 4 or stage 5. But when you look at the numbers of chronic kidney disease and the amount of people that are unfortunately trending towards dialysis, there's a big opportunity to help these people, and this is a really strong plan. We're talking about unlimited transportation. They're going to get dialysis. They're going to get all the other benefits that we offer, though, too, because a lot of times we'll have additional conditions, maybe diabetes or others, right? So they're going to get the $0 insulin. They're going to get the 0 CGM, all of those benefits baked into one.
I was going to say, I'm just looking at my obesity map and overlaying it with where Zing is expanding to for chronic conditions. I think my obesity map and my possible diabetes, chronic conditions, and Zing expansions might have some synergies there.
Yeah, and we were talking about the call letter for next year. Everyone was so focused on the compensation pieces and some of the other health plan facing pieces that a lot of people missed that they pretty significantly expanded the chronic list to include diabetes. Now it will be for plan year 2026, but as we talked about, when you look at where the market is trending, you look at the D-SNP changes coming where it's going to be more difficult for some carriers to stay in that market or to be able to utilize that SEP. C-SNP is the next logical jump, and we think we're a couple years ahead in terms of some of the specific processes that we do, including auto verification of C-SNP, which we'll talk about, and then the product set, right? We feel very strongly that our product set is the strongest in the market, and then we do some other things to make it easy to do business with in an agency or partner perspective.
Let's talk about that too, because I also think so. We were just talking about expanding those chronic conditions, so your addressable market of who is eligible is going to continue to grow, right?
Exactly,
Because how many in a particular marketplace, what percentage of the total Medicare beneficiaries are truly available for chronic or eligible for chronic at this point?
50% of MA eligibles have a C-SNP qualification.
And candidly, the reason I bring it up is because typically your benefits are going to be a lot more attractive, and it's going to be the care coordination and the managed side of it, which I'm sure we're going to get into, which to brokers listening, that's why we're trying to call to your attention that behind the scenes, after you write them a plan, there's going to be a lot more behind there that's actually going to provide a better experience, keep your members happy, really be doing a managed care model, which we really actually want to have.
To add on to that, like, obviously we've talked on this podcast before. Dan and I are big fans of model of care, right? We've talked about some of the new IE SNPs that are going to be expanding, even though one of the major carriers kind of killed that off for a minute.
That's another day.
Yeah. But we do these different models of care, guys. Like, I think a lot of agents have the mindset that a C-SNP is kind of like a gimmicky trick to be able to sell products year round when SEPs were more enforced year round. And I think that's kind of the perception I know that a lot of agents have is, well, C-SNPs are not even actually that good. They're just kind of like a tricky plan that has an SEP that you can enroll them in. And what I like about what you guys are doing is there are a lot of chronic conditions are, in my opinion, one of the biggest health threats or the biggest health threat to our entire country and our population that exists. And so these plans that are specifically designed with this model of care to improve those conditions are exactly why, Zing is filling that market share right there.
Oh, 100%. I mean, and quite honestly, in years past, it did feel like some carriers offered C-SNP kind of out of obligation, where there wasn't honestly a huge difference between the general enrollment plan and the C-SNP plan. It was pretty hard for an agent to explain why they should go with that C-SNP. And to your point, we're really changing that by how we're designing the benefits up front, right? We've talked about zero insulin or zero CGM, the formularies where you're going to see a huge difference, right? So a C-SNP plan is going to have a tier 6 at a $0 copay that's going to include things like Ozempic and Jardiance and Trulicity, right? So significant savings to the member on the formulary. But what we're really trying to do is we want members that are serious about managing their condition and want help being healthy, right? That's the right member for us. Somebody just searching for $1 more of OTC or dental and vision, like, yes, we offer those benefits, but what we're trying to do is focus on having them live a healthy life, right? So the model of care, when you talk about what we're doing, vast majority of our membership is in a capitated model, right? So for fancy speak for the agents, that just means that we have providers that are assuming some level of risk, and they get an incentive to be proactive in managed care as opposed to just fee for service, right? Where every cog is worth the same amount of dollars and you just rifle people through as quickly as you can. We have groups that are incentivized to make sure that the member gets the good quality of care. And a lot of that is quarterbacking, right? I mean, when we go to the doctor, if you're not 65, you're going to see an MA, you're going to see a nurse practitioner, then you're going to see the PA, then you're going to see a doctor maybe for 2 seconds with the resident, right? Now try doing that at 85 years old where you're managing several conditions. You've got 8 to 10 drugs you're taking. You're shuffling all over town to different doctor's appointments. So having that quarterback that can really help the member understand what they're doing and why, and have that be a functional process that might include free transportation and other benefits is really helpful to the seniors just for quality of life or ease of use.
Well, and that's one of the things that we've talked about before too, is that also sometimes people are on a broad PPO plan and you have multiple health systems, and guess what? They're not communicating, and they're actually even prescribing medications that are actually counteracting one another, having a lot of bad interactions. And I mean, we see that pretty frequently. And so sometimes you find those people that yes, they have complicated health conditions, and so they think that by getting a really broad PPO and having access everywhere is what they want. And the reality is sometimes they just need to have somebody actually closely managing them instead.
Well, one thing I wanted to go a little bit deeper on is you mentioned obesity and the drugs like Ozempic. Go a little bit deeper on the GLP-1s, because those, it's everybody's talking about those right now, and the possible seismic cost that, I've seen projections that say like 20 to 30% of the entire population are going to be on GLP-1s in the next 5 to 10 years. And, of course, there are people who believe they're miracle drugs, and they are yielding a lot of results, specifically with people with obesity. So if somebody gets on a Zing plan, are those GLP-1s like Ozempic going to be covered for them for the treatment of diabetes and obesity?
Yeah, so it's going to be for diabetes, right? So obesity is a 2026 and forward, official condition, right? So obviously it would stand to reason that a lot of people that have diabetes might be considered overweight or obese based on the BMI metrics. I mean, I would probably fall on that scale myself. I'm working on it, but it's something that it would hit a lot of people, right? But to your point, for this year, and 2025 isn't final yet, I would say that the overall strategy is to continue to be very aggressive on formulary in terms of reducing the cost the best we can to members up front. So I wouldn't expect our strategy to change much. And right now, yes, to your point, Ozempic, Jardiance, Trulicity, several other drugs are covered in that tier 6 at a $0 copay when they're prescribed for what they're supposed to be used for, right? And the thought behind those drugs is a lot of times it's getting someone to a manageable level that can then help better manage the actual underlying condition, and that's the reason why we're covering those drugs.
Makes sense.
To help with their hypertension or some of their other,
and tier 6 with Zing is a $0, correct? So that's opposite of some carriers where it's the higher the more expensive.
Right. And one thing that we maybe didn't talk about, that every once in a while I get in these podcasts, and because I have this accumulated knowledge, it's almost like assumed that everybody listening is the same.
I do the same thing. Yeah.
And so one of the things that we probably should talk about is just the reimbursement is different from CMS to a health plan on a traditional Medicare Advantage, a C-SNP, and a D-SNP, right?
Yes.
And so those are one of the very fundamental topics. I don't know if you can share or what you can share, but that's the reason why. When you're an agent, you're doing a great job, or being a broker and find out if people qualify for, like we always say, hey, if somebody's like a Slim B or something, they can qualify for a partial dual, put them on a partial dual, because, in theory, that plan gets more funding dollars and can therefore create a much more plan tailored for their specific needs. And the same idea is with the chronic or the full dual plans, where, again, asking the right questions and getting in this plan is typically going to be better than just a traditional Medicare Advantage plan. Can you speak to that at all?
Yeah, 100%.
Yeah, I think too that the other thing that's prohibited agents from selling chronics in the past is the fact that they had to get a doctor verification, and anytime there's friction for agents or friction for the consumer, it's like blinders, they're going to go with the Amazon checkout model where they can just swipe over and buy their things, whatever's easiest for enrollment, and they don't want one more step of auto verification. Can you talk about Zing's auto chronic verification?
And everybody, their AHIP's coming out next week. How many days is it with the verification form that people have to do usually on a chronic plan?
Yeah, well, I mean, you technically have 60 days to complete the process, but the problem for C-SNP, and this was the first question I asked before considering coming over to Zing, was about the verification of chronic conditions. So VOCC, you'll hear it referenced a lot. Traditionally, that's been really painful for all agents, but it's particularly, a shop like you guys where you're writing a good amount of volume and you look up and you wrote 100, you submit 100 and you're lucky if 40 of them get through, right? Mm-hmm. And more importantly, it's a really bad member experience, because what happens is you complete the needs assessment, you determine the C-SNP is the right plan, the agent does what they need to do, but we all know how the provider world is right now. They're very busy, right? A lot of providers are being aggregated and bought up by these big groups, right? It's easy to go to Mike and say, hey, you're working 80 hours a week right now doing all your claims and billing and seeing patients. Why don't you come work under this hospital system? You can work 3 days a week and make the same money or more. Right. And so what ends up happening is that form that's going to, Johnny in the back office sits there and doesn't get completed. And that means after the 60 days, they're going to get a letter from that carrier saying we couldn't qualify your condition. it gives you a new SEP, but the member's only going to do
Disenrolled.
that.
Yeah.
They're only going to do that once or twice before they start asking, like, does my agent know what they're doing? Does this carrier know what they're doing?
Well, and an agent's only going to do that a few times
yeah,
too
and the agent-
before they're like, screw that, I'm going to go.
And then, of
path
course,
least
the
resistance.
agent's going to point the dirty finger at the provider, too, and go, your provider's office is not doing this verification.
Yep.
They must really not want you as a patient bad enough to fill out one form and get it back.
Exactly.
So it also is kind of a bad experience overall from the consumer to the member to the provider.
Yeah, exactly. And
Had been
and
historically.
as we talked about, we rely on our provider relationships, right? That's a huge part of our strategy is working together to offer the best model of care. So back to the point on the form, we have the only CMS approved auto verification algorithm. So essentially,
Say that again.
Yep,
And
the only
really,
CMS approved auto verification of chronic conditions, which means we have access to information that can tell us 1 + 1 = 2, and we can verify automatically or through our medical director that based on what we're seeing, we know this particular member qualifies for a CSNP, and we're doing that between 85 to 90% of the time. So now, most carriers, you're lucky to have 50%, maybe 60 if they're good. We're at 85, 90 consistently, which means we're going to have maybe 15, 10% of the time where we would provide an RFI report to you or to an agent that says, hey, we've tried everything we can to get a hold of this provider or to validate, and we're not able to. Do you want to give it one more shot? But we do a lot of that work up through the 30-day mark, and then we pass off to the agent to at least make sure they're aware, because sometimes they're more willing to answer the phone from the agent than they are from us, right? So but it's a coordinated process, and we're able to really tighten that up and get an additional percentage of that completed and get the people in the plan.
That's good. And also one big element to that is, of course, you're on Sunfire and for applications, which is a pain point for me, for those not listening. And they've made strides in actually bringing on a lot more CSNPs. But because of that extra step in eligibility and verification, there were a lot of CSNP plans out there, Hickens or PBPs, that we just never could get on our platform. And it made it a real challenge for us to distribute and go wide and actually get a lot of brokers to adopt and sell those products. And so I think that made a big difference as well.
Yeah, and we work closely with them. There's someone that may have recruited me over to Zing that now works over there that I bug on the daily.
Which we may talk to sometimes, yeah.
Which we may be coming out here next week based on my conversation with him earlier today.
Exactly, yes.
So, but it's definitely top of mind for us. And back to the platform piece, I mean, all joking aside, that is one thing where I think there's opportunity for improvement, because another thing is just you do have to hit the separate SNP radio button, and sometimes it's just for agents forgetting to even think about it, right? So we're always after them of like, hey, put a banner ad out there just to remind people, are you asking the CSNP questions? Or can we integrate the drug list where it would give you a pop to say, hey, you've entered a drug into the needs analysis that indicates this person might be eligible for a CSNP. So we're constantly talking with them and all of our enrollment platform partners around how do we make it easier for the agent to at least give them that reminder. But obviously, to your earlier point on the needs analysis, if the agent's asking those questions, they're going to stumble upon those people with the way that they're asking, right? And so there are some that'll go very direct. Do you take insulin? Have you been told that you're diabetic? Have you had a heart attack? Some will go a little bit more nuanced. Do you take more than 8 to 10 drugs a month? Have you ever, do you have a special doctor that you see more regularly for a particular condition? There are different ways that you can ask the questions that get you to the meat of, is this person a fit for a CSNP plan?
Yep. Fantastic. The other thing I think we ought to spend a little bit of time talking about is, I'm already thinking about next week in AHIP. I'm already thinking about the flood of phone calls that I'm going to get on the FMO side, and I tell all the carriers out there, hopefully you're going to pay us for the services we're providing, because I'm going to be bombarded next week doing walkthrough videos, and my staff is, and teaching agents how to do it. But just thinking about the experience that you all offer. So we have varying levels of experience with quote smaller carriers or regionals, and sometimes they're just not very tech centric. And the one thing that I really do like about you guys and made the decision a lot easier for us to do business was how you all have a leadership team that has a lot of experience in the industry. And so I think that you made the tech side great and easy for us to give people an example. We can set our reporting from you guys, you get it daily, weekly, or whatever, and we get those reports in that cadence sent to us. So we, as a distributor or FMO, we get our roster report, our ready to sell status, everything else like that. I'm not having to go call around and talk to Janie in some department and send me some manual report. It's all automated and it's easy for us to see. The commissions portal is very easy for people to access and to see their statements. And I think that's a big important element too for brokers that are listening that consider like, oh, should I get aligned or should I get a contract with these folks? So.
Yeah. And yeah, to your point, you guys mentioned Andrew before, Clifton, our CEO, a lot of time in the space, Matt, who's just off screen here today, Vanderbosch, our CGO, several years in the experience, myself, Chris Murray that you mentioned, a lot of our Laura Garlich who runs sales ops and performance for us, all of us nearing 20 years in the business. And that was one of the main questions we all asked was, it's going to be, it's going to be hard enough to tell the story and get agents and partners to want to try because, a couple of years ago when we first started, it was a very small percentage that were willing to look at CSNP. So you've got to make it easy, right? So you've got to have access to the onboarding platforms where you can just, from your guys' office, your team can literally send out an email in 2 seconds, right, to somebody to onboard. You've got to have that agent be able to view their application status and all that stuff in the portal. But then for you guys at the partner level, getting the RFI report, getting the missing PCP, getting the commission files, the agency status, the member status, all the stuff that you guys can effectively run your business and make sure your agents understand what's needed or what's not needed is, I think we're going to be on par with a lot of the big guys in terms of what we provide for reporting, which is intentional, right? And the processes too, being on all the enrollment platforms, being able to be easy to do business with is definitely number one priority for us. And when you look at CSNP and you look at our success over the last year, we were in the top 20 of all carriers, both for general enrollment and CSNP, top 5 for CSNP in terms of growth. We had like 200% growth in the regular plans, almost 500% growth in CSNP. So we've had a huge success from January 23 to current on bringing on new groups, but similar to your point where you're not just going to go work with every carrier, we've taken the same approach. We want agents that want to help their members get onto a CSNP plan and understand the benefit, and we want partners that are strategic and do things the right way. So we're not, same like you guys, we're not going to go out and just offer a contract to everybody. We want strategic, deep partnerships where we can grow together with our key groups.
Yeah, one more thing I wanted to give you guys a shout out that I'm not going to necessarily say what we all landed on, but you guys were the first with, in collaboration with us to have a strategy going forward coming out of this murky FMO back-end compensation
CMS,
stuff.
TPMO stuff.
And so, just in kind of collaboration together, we just kind of had our interpretations and we moved forward. And so that's the kind of partnership that we like and value too. And that's the kind of company that you guys are is, a great team, great leadership saying, hey, this is how we're taking it. This is how we interpret it as well. And let's go until someone specifically tells us we can't go otherwise.
Yeah.
And
no one's saying a lot of anything at the moment, but yeah, we're our plan. And, I've made this commitment to you guys, privately and would make it here because the same would go for agents. Our plan is to be easy to do business with, to be innovative, to find a way to make sure that we can continue to grow in a way that fits within whatever these new rules are going to be, but a way that we can still be aggressive, right? You made comments before where, some carriers have come out and been pretty public on, plan exits and, the rumblings around the amount of dollars changing in their benefits and stuff. And we're going to stay very aggressive and grow because we see this as a huge opportunity. Change is scary at times, but there's a lot of opportunity as well. And that's the side we see.
Well, and I think that to kind of paint the picture in the landscape for brokers that are listening to is even, again, we can break down the call letter. I almost just, we've talked about it ad nauseum, right? So much this new call letter and how significant it was, but the landscape's even going to be changing on the DSNP side. And when I say there's going to be the auto enrollments with the actual true DSNP plans out there, brokers aren't seeing it yet and don't understand how that's going to really change the plans and the carriers out there that actually have the state Medicaid contract and the auto enrollments, and you're not going to be getting those with the lookalike plans and the other ones that don't have the state contract. And what you're going to find is these CSNP plans who are getting the higher reimbursement rate
that are all fully aligned. Yep.
Exactly. Are going to be able to create benefit structures and products that are very, very appealing that are, again, they're chronic special needs plans instead of dual special needs plans, but from a funding environment and a competitive perspective, they're going to play out very competitively in that landscape moving forward.
Yeah, 100%. And, one other thing that we have in the market now and we'll continue to learn into is what we call a dual focus plan. There is a heavy overlap between DSNP and CSNP eligibles. And you know, as you all know, can't do a DSNP lookalike anymore, but you can do a lookalike on a CSNP chassis where it will coordinate care, but then still give that CSNP forward coverage, right? So we have that plan available today, and we'll probably continue to grow that as part of our footprint as well. So then there will be situations where there's kind of the best of both worlds for people that want to leverage both sides of that coin. But that'll be something we'll look at. But to your point around the DSNP piece, back to our earlier conversation, everyone was hyper focused on distribution and compensation, and rightfully so. But the DSNP stuff really snuck under the radar. Even when we were out in Vegas together, I was telling people for the first time what that meant.
Yep.
And I think now people are starting to get a grasp of it. And when you do the math, I know you guys watch the earnings calls and look at all the publicly traded companies on the carrier side, and on the distribution side. There's a significant portion for all the main carriers that are sitting in DSNP that do not now have these MCO contracts.
Correct.
Right.
Yep.
So that creates opportunity, but also a lot of upheaval, right? In terms of
Correct.
How do we keep these members? Are they in the right plan? Where are they going to go?
And that's what I'm alluding to is the board's going to get shuffled a little bit over these next couple of years, right? And I don't think that there's enough awareness from the broker community yet about how that's going to come to fruition.
Yep.
So I think that's important for us to continue to touch on and for people to follow. And that's part of why I'm bringing this, that people, maybe there's carriers like Zing and others, they're like, oh, who's Zing? And then as you guys continue to expand and take in more market share and grow, it's going to make sense and hopefully click at some point as to why the partnership, why we're out in front, why we're okay promoting it and saying, here's why we're getting behind it. Right?
Yeah, no, and we're really excited. I mean, what we've seen is with the right partners, you create the training, you create the infrastructure, you get people comfortable, and once you're going, it starts to snowball, right? It's just like anything else.
Yeah.
Like we said, it's just like DSNP several years back, or all the changes, on MA, if you've been around long enough, it was HMOs with a premium, and then, now there's PPOs, and then there's zero premium. This market, the only consistent thing is change. And once we have people that give us a shot and understand how to ask the right question and how to find the right people, we're having a lot of success where they're coming back, hey, how do I add more agents in my shop? How do I do this? How do I do that? So it's just getting the ball rolling.
Well, and not only that, but when you talk about, a big part was VBC providers do you have any fee-for-service providers at all?
I mean, a very, very small percentage. Our goal is to be 100% on the VBC side.
So when you're talking risk, and for those not like capitation or risk.
Value-based care is VBC.
Yeah, so going back to those value-based care providers, having that be completely almost your providers that exist in the marketplace, you're going to have a much better quality experience with 4.5 star to 5-star plans. For me at least, we're always trying to find wins with so much volatility. From our perspective, we're looking at LTV, right? We're looking at that lifetime value. We want to find those carriers and products that we can sell and promote, do a very good needs analysis, get them on the right product, and then have them have a great experience and stay on there. And I think that we want that as a distributor, the brokers want that, and the member want that. Yeah. And I would even tell you, very critical of the carriers and the fact that so many of them get sideways on their financials, and then they're like, oh, hey, we're three stars with this plan. Oh, yeah, that plan's crappy. We have this new plan that is new to the market, so enroll on this plan over here instead. And so I think that across the country, CMS has allowed a lot of the carriers to, kind of get sideways and then just introduce new products and then crosswalk, and they actually cause a lot of the friction in the movement. You know what I mean? It's not necessarily the broker, but I think that, the broker community has very much been the scapegoat of, why there's so much movement and friction with the consumers. Yeah. So again, going back to that, I like, that's part of the reason too that we like your products when it's available in a geo area, when it's the right fit. When you can identify and qualify that prospect for it, it's a great opportunity to put them there.
Yeah, to Dan's point, I think our agents in general, I feel like, are much more sophisticated, and especially some of our agents that maybe sell in multi-states virtually, we kind of call them like the special forces of agents. And then there's a bunch of agents that listen to this podcast that care about deep, in-depth information. So if you're one of these agents that wants a really good specialized tool, you want to be an expert in your field, and you're in those states that we talked about where Zing is, we'd love to pick up your contract, love to plug you guys in with with a great company like this. And
there's even some VBC opportunities at times for agents too, working in conjunction and hand in hand with you guys as well.
Yeah, right? and that's the other piece we didn't touch on, but the other piece that's really important to us is the provider network. What we don't want to do is limp into a market and then have an agent, sell someone and the nearest doctor is 50 miles away, right?
Yeah.
So we don't enter a market unless we know we've got the systems we need to have, and then we're constantly adding providers. We've got some big groups we're on the verge of being able to announce this summer, along with some other exciting news, but we're really comfortable and confident in where we're going into for new markets, but then continuing to build on the existing. So that's another thing too. I know people are thinking in the back of their head, what's the provider network look like when it's a regional growing plan? That is where we, outside of building the product, where we spend a significant amount of our time is not just the VBCs, but just overall, bench strength of providers. But then when you look at the VBCs, we've had a lot of success with getting a lot of the big names you guys know to contract with us, because they see the upside too on when you coordinate that care. Not only you're doing right by the member, but it's a more sustainable business model for everybody.
100%. Before we wrap, because we're almost at time, I thought, are we able to talk maybe just high level, maybe cliff notes about, lawsuits are, very much on everybody's minds these days. There's a whole litany of lawsuits right now with CMS. Scan, made the news, in a very significant way, Elevance. And you guys were actually, Zing was one of the carriers that also had a lawsuit with CMS. Just in regarding to the calculation of star ratings. And I think that, we don't want to say too much, but you were maybe one of the names that was not thought of as much. They were, again, Elevance and,
because they're larger,
Yeah, they got a little bit more attention, but candidly, you all were in the same boat going, wait a minute. These star ratings were not favorable and not calculated the way that they should have been, and that's been something that Zing's been tied up in for some period of time now, correct?
Yeah, no, absolutely, yeah. And so we, I joked with some of the crew earlier today because I saw a LinkedIn meme with Elevance Scan and Zing with the girl with the house on fire, and I said, "Hey, Mom, we made it. We made it on the list."
Yeah.
But the long and short of it is, we were notified that the rescission of the plan that was impacted because of the STARS determination would be removed by CMS. We're currently in the process of understanding what that's going to mean for us in terms of the rest of 24. We are able to refile those bids quickly
by June 28th, right?
For June for 2025 if we'd like to. So we're still a little bit in flux on, hey, how do we want to handle this? What's the best way to do it? We do have other contracts out that are doing really well, so we want to be mindful of member abrasion and confusion. So we're trying to think through that piece, but the long and short of it is, you're right. We are very pleased that CMS agreed with us that the initial classification of the stars was inaccurate, and that our assumptions did hold up as being the correct way to understand the methodology used. And now we're in kind of a mad dash here because, like you said, we've got a week and a half to decide what we want to do. But long story short, it does help us, right? It's a growing plan, and anytime you have something splash in the news like we did in January that looks negative, when that changes, you want to make sure that people understand what that means. And then to your point, it can be painful for a smaller company, even more so than a bigger one, right? Because you've got less room for error. So we're happy about it, and with more to come in the next week or two on how we're going to handle it.
Yeah, and what a timeline, right? You go from usually you're doing war games and bid and everything else, right? You're not even quite through your AEP season when you're trying to get your bid ready for the next year, and now it's like, oh hey, you know what? All these plans now you can rebid and refile again. We're going to open that back up, and you have a whole whopping 2 weeks to get it done. Right?
Yeah. There used to be I swear there used to be a pause in this business. It doesn't exist anymore.
We were just saying that before the podcast,
dude.
It's a marathon sprint all year long.
But long story short, a lot of stuff we're really excited about this summer with the expansion. We'll have some other stuff coming out that will really kind of accentuate our position for the future and why we feel so bullish about the Zing opportunity. And then in addition, obviously the CMS news helps kind of reaffirm that as well. So we're excited to move into 25, super excited to work with you guys. We've been chasing you for almost a year now, I think, trying to build a partnership out, and we're excited to kick it off here shortly.
Yep. It came to fruition. It takes a little bit of time, but we're on board.
It was a good relationship built on open communication and trust.
Yep,
exactly.
So,
very true. Any last thoughts before we wrap up and finalize?
No, if you're just one last plug out there, if you're a lurker, you're one of the 98% that's not subscribed watching this, please subscribe. And we'd love to have your Zing contract if you sell in that Rust Belt type area.
Yep.
So,
Absolutely, and more to come. A lot more opportunities. So keep on the lookout for Zing. Appreciate the partnership.
Thanks, Marcel. Thanks
making
for
it
coming
out.
out.
Yeah, thanks for having me. Really excited. Thanks, guys.
Agent Boost.